Hi, welcome to part 2 of yoga therapy for a stiff back. My name is Megan Elliott, and I'm here to let you know that anything that you go through in these next couple of poses that I'm going to show you should not cause you any pain. Sensation, yes. Pain, no. If you feel pain, then you need to back off or stop completely and go see a doctor, get a diagnosis as to what's going on. And also importantly, follow your breath. I'll be giving you breathing cues. Follow those breathing cues. That's what a big difference between just simply doing an exercise and actually doing yoga and bringing it in and making that connection between the mind and body. Okay, so I'm going to show you 3 postures and then a 4th, which is the restorative pose at the end. And all of these postures are going to take you a little bit deeper into gently stretching the low back and a little bit of opening in the front of the body. Okay, let's begin. So we'll start. You're going to have some floor space here. You don't need a lot, but you're going to need a little bit of floor space. You're going to come into all fours, very similar to the cat and cow that we did in the first part. So you're going to get hands underneath shoulders and knees underneath your hips. So starting with an inhale, broaden the chest forward without crunching the low back. Roll the shoulders back and down. This is your inhale. Chin can come a little bit more neutral. And on your exhale, rather than just pressing your butt directly back into what in yoga we call child's pose, bringing the chest first. So you'll bend the elbows, you'll bring the chest down first, and then followed by the butt. The head will come down, arms will extend, and the head rests down on the floor. Now, if this feels really difficult to actually get your butt to your heels, just find a pillow or something to stuff in between your thighs and your calves. And that'll create a little less strain on your knees or on your low back. If your head doesn't get to the floor and you're right about here, you can get a pillow or stack your fists and rest your head. It's very important that your body comes into a resting state at the bottom of the exhale and at the beginning of the inhale. So you'll be at your bottom of your exhale once you get down here. So it can look something like that, where your head is resting on something and your legs are supported. On your inhale, you come up, broaden the chest, slightly lift the tailbone. Okay? So you'll do that about, I would say, 6 times in each direction. And I'll do a few in silence so that you can see the motion. Notice that I'm not rushing this and I'm moving on my breath. Also, I'm not cranking my chin up. Leave the chin neutral so the spine of the neck can be protected. Alright, so that's the first section. Second is on your belly. So make some room for your legs, extend the legs out, and come down onto your belly. So trying to get into the camera so you can see. It's important for the posture here to remember that for some folks, being up this high is going to create strain on the low part of the back. We want to feel a little bit of compression, but no pain. So if this is too high for you to get into, just lessen the arch in the back by opening the elbows out to the sides. You can come all the way down and rest your forehead or chin on the ground. That might even be enough. Or anywhere in between. Okay, so just remember that if the shoulders are like this, press the shoulders down and away from the ears. Also, if you're up in the full extension of the position, one of the common mistakes is people either slide their shoulders, elbows too forward, or actually even more commonly is what they'll do is they'll have their elbows back and they're feeling like they're not supported. You really are fully supported here. I'm fully supported by the base of my elbow and forearm onto the ground.
Now if you feel like you would like to get a little bit deeper, no pain, no compression here, you're feeling ready to go, just open your forearms out, inhale, and extend your elbows. And pause. You can open your legs a little bit more into a wider V. So whatever position that you're in, whether you're in the peak of this position up high, or you're all the way down on your belly low, I would say hold for about 30 to a minute, 30 seconds to a minute. Make sure to fully breathe and relax as much as you can while holding the posture. And when you're ready to come out, I would say from here you can just roll directly onto your back. On your back, another gentle stretch for the low back. Keep the knees bent. Exhale, one knee in towards the chest. Inhale, extend the leg. The knee can be slightly bent as needed, and push up through the heel. Let the low back come down firmly into the floor, and the chin is more neutral. Exhale back in and down to the ground. Other side. Exhale. Inhale, extend. Exhale and down. Exhale. Inhale. Push the heel up and low back down. Exhale and down. And repeat on the other side. Inhale, exhale, and down. I would say do this about 6 times on each side. And then for the final piece, when you come off your back, always remember to roll onto the side, not putting strain on your back to get up. I grabbed an office chair so that you can see that this can be done anywhere. I got a blanket. You can use whatever you have. Just make sure that it's folded and not all crumply under the low back. Get the long side of your blanket or pillow and stuff it right behind your low back. Your buns are on the ground. Your chair or the bed or the wall is close by. Come back onto your forearms. Slide the blanket closer. And they'll switch the legs and lift the blanket underneath. So the blanket's going to be under the sacrum, that wide bony piece lowest to your back. And then the mid-back is going to be a little bit off the floor. Let the arms rest on the side. Take a few, or on your belly, and take a few belly breaths. Let the body relax and rest. When you're ready to come out, draw your knees in towards your chest. Breathe, inhale. And as you exhale, roll over to the side and bring yourself up. So this completes the second session of the 3-part series. Take it slow, lots of breathing, and move into sensation, not pain. Looking forward to seeing you next time. Bye-bye.